Another update from our ABC15 investigators. A state agency has announced major changes at one of Arizona's largest medical imaging providers after we exposed disturbing details of an MRI scan gone wrong and a failure by the state to regulate. Investigator Jennifer Kowaleski shows us the changes to improve patient safety.
It sucked her into the machine, into the hole of the MRI machine.
This shocking and what experts now call preventable MRI incident caused serious injuries to Tawny-san's sister, inmate Lacey Windust.
It had to have hurt so bad.
And raised serious questions about a breakdown in patient safety at one of Arizona's largest medical imaging providers.
People are shocked and stunned that these kinds of accidents, these kinds of anticipatable accidents, continue to occur.
It also exposed how SimonMed was getting to play by different regulatory rules in Arizona, operating unlicensed and unregulated by the state health department. But those rules are now starting to change.
Creates more accountability.
We'll hear more from MRI safety expert Tobias Gilk and explain exactly how the health department is forcing accountability at SimonMed, starting with this location it recently licensed. But first, let's go back to what compelled the state to take action.
It's just pure stupidity to me.
As we've previously reported, her sister Lacey went in for an MRI scan at this SimonMed in Avondale last year, when according to Department of Correction reports, a SimonMed tech made a decision not to remove the metal shackles around her waist. MRI machines are basically giant magnets. So that decision caused Lacey to fly into the air and get stuck to the MRI machine. The prison guard says the SimonMed tech then asked him to go in and help Lacey.
And it sucked him into the machine because of his gun.
Here's where we uncovered the state was failing to regulate. After the ABC15 investigators started asking questions, the health department told us the SimonMed in Avondale was not regulated by the department, preventing the state from investigating or taking any enforcement action. And we couldn't find a license for any of SimonMed's Arizona imaging centers.
I think that is terrible. I don't even understand that.
We learned it's all because of a private provider exemption the state granted SimonMed when we questioned how one of Arizona's largest medical imaging centers, with more than 60 locations across the state, could still be considered physician-owned and operated, especially after this private equity firm announced a major investment in the company 2 years ago. The health department said it was reviewing SimonMed's exemption.
Well, I think it points to sort of the bigger problem of the treatment of MRI, but also outpatient imaging centers and the ways in which they often skirt regulatory or licensure oversight.
As promised, here's what is changing. The health department says it recently issued a license to this SimonMed location, that's in Anthem, and expects the company to submit licensing applications for many more facilities soon.
I think what it says is that investigative reporting creates change, creates positive change.
In a statement, the health department said in part, SimonMed has been cooperative and is fully in agreement that a facility providing care and services to patients that is not under the operational control of the licensed provider working at the location requires licensure by ADHS. What is your message to the health department?
I guess first, thank you, and helping make sure that patients have an outlet for accountability.
The health department has now licensed 4 more SimonMed locations, 3 in Peoria and 1 in Surprise, but not the location in Avondale where Lacey was injured. We reached out to SimonMed about these changes, and the company declined to comment. We will continue our reporting. I'm investigator Jennifer Kowaleski, ABC15 Arizona.